Okay, recording in progress. Welcome everyone. My name is Holli Drobny. I am the Mental Health Services Act Coordinator at Butte County Behavioral Health, and I also serve as the Public Information Officer. I've been with behavioral health for, next week will be 7 years, and I've been in this position just over 3. So I'm born and raised in Chico, California, have strong ties to the community and feel very fortunate to be able to serve in this way. So today we're going to talk specifically about the Mental Health Services Act. I'll briefly do a quick introduction about Butte County Behavioral Health just to get a little bit of context about our department and the mandates that we are under with our contract with the Department of Healthcare Services. So Butte County Behavioral Health serves those with provides services to those who are seriously mentally ill and substance use disorder treatment to Medi-Cal beneficiaries specifically. The department also provides crisis services to beneficiaries regardless of their insurance, but mostly our target population is those who have severe symptoms of a mental illness or substance use disorder and who are indigent, who do not have insurance or are Medi-Cal beneficiaries. Services are mostly voluntary and include prevention, outpatient, substance use disorder, and wellness services. We also have a 16-bed psychiatric health facility, which is an inpatient program. I forgot that I had done that. The SMI is defined as somebody as mental, behavioral, or emotional disorder resulting in serious functional impairment, which substantially interferes with or limits one or more major activities in their life. So this is data from fiscal year 2019 to 2020. And so you can see that began on July 1st, 2019. And the end of our fiscal year was impacted with COVID-19. But just to give you an idea on average, the number of individuals that we serve or who are open to services. In our outpatient, that table is on the left-hand side. We have our total. We have then it broken down by mental health services and then total substance use disorder. And people may be enrolled in mental health and substance use disorder treatment at the same time. For our inpatient facility, and that's either locally or when that facility is full, we send our clients out of county to other inpatient facilities. The total number of people that were served during that fiscal year is 563, also broken down by adult and youth. And then there are individuals who will be admitted more than once to an inpatient facility, so total admissions are 777. I did mention our crisis services that we serve Butte County residents regardless of their health insurance. And so for crisis services, the distinct count of clients is 2,104, and total crisis calls are 6,175. So just to give you an idea of the population we serve. So the Mental Health Services Act specifically is a funding stream that is dedicated to Butte County to all county mental health plans. I do have a brief video, it's about 10 minutes long. And this is an intro to the MHSA that was requested through our MHSA steering committee. And you'll understand a little bit more why this is so important after the video, and we can discuss at that time. So I am going to reshare my screen. Give me 1 second here. And I want to make sure everyone can hear me. So give me let me know if you can't hear this.
This presentation serves to provide the viewer with a basic introduction to the Mental Health Services Act, also known as MHSA. You will learn how the Act came to be, its guiding principles, its funding characteristics,
Holly, it stopped the audio.
Proposition 63, creating the Mental Health Services Act. This act produced an additional 1% tax on any California resident making more than $1 million in order to enhance the system of care for mental health services. The need for an enhanced system of care was born out of community and stakeholders urging for systemic change. Prop 63 was a legislative movement to provide better coordinated and more comprehensive care to those with mental illness with a focus on underserved populations. The MHSA is also unique as its purpose includes reducing the impact of untreated mental illness on individuals, families, and state and local budgets. Approximately 0.1% of taxpayers are impacted by this tax, but since its inception, it has generated approximately $14 billion statewide. The passing of Prop 63 provided the first opportunity in many years to expand county mental health programs for all populations and age groups. Children 0 to 15 years old, transition age youth 16 to 25 years old, adults 26 to 59, and older adults 60 years and older. Programming also focuses on families and especially the unserved and/or underserved populations. These guiding principles should be included in all areas of MHSA, and programming should be designed to implement the core values of community collaboration, cultural competence, services that are client-driven by adults and family-driven for youth. All services must be focused on wellness, recovery, and resiliency, and MHSA programming should provide an integrated service experience. Each year, MHSA revenue from taxes is collected, and before it's allocated to counties, 5% is allocated to statewide administrative and oversight of the MHSA. Funds are then distributed to counties on a monthly basis by utilizing a formula that considers many factors, such as population, poverty, Medicaid enrollees, and prevalence rates of mental illness. Counties have strict guidelines for how they can spend their annual allocation, with approximately 75% being allocated to community services and supports, 20% to prevention and early intervention, and 5% to innovation. Of that annual allocation, counties can divert up to 20% to the prudent reserve, which is a savings account to be used during an economic downturn, or capital facilities and technology, and workforce and education and training. Counties may use 5% of their total annual MHSA revenues for the local planning process. Butte County programs. Community Services and Supports, also known as CS&S, is the largest funding allocation for each county. Butte County achieves the goals of the CS&S component through internal programming and through contracted service providers. Full Service Partnership is programming designed for community members who encounter severe symptoms from their mental illness. This programming is highly monitored and delivers the most intensive case management services for all age groups. The majority of CS&S funding is dedicated to Full Service Partnerships. Crisis Services was established before the MHSA, but the introduction of the MHSA allowed for expansion of crisis services, which includes our mobile crisis team, crisis residential facility, and our Triage Connect team. Butte County has wellness and recovery centers throughout the county, which allows for peer support and socialization, along with peer-led activities and community resources. Butte County has a robust vocational rehabilitation programming, which provides supported employment, career guidance, and counseling for behavioral health clients. The supporting homelessness category is an umbrella term that covers initiatives such as 6th Street Drop-In Center for Homeless Youth, peer partnership program at the tourist shelter, and supportive housing programs for transition age youth, adults, and older adults. Prevention and Early Intervention, also known as PEI, aims to serve those who have yet to engage in mental health services. Service strategies in this component include prevention, early intervention, outreach for increasing recognition of early signs of mental illness, stigma and discrimination reduction, suicide prevention, access and linkage to treatment, and to improve timely access to services for underserved populations. Butte County achieves the goals of the PEI component through internal programming and through contracted service providers. Community education includes our efforts with the statewide mental health campaign called Each Mind Matters and our local outreach and engagement efforts to increase awareness of mental wellness. The prevention unit works with adolescents to reduce risk factors and increase protective factors surrounding mental illness and substance abuse. Cultural outreach programs target underserved populations and work to overcome barriers to accessing treatment, including increasing awareness and addressing stigma. Early intervention programs focus on access and linkage to the appropriate level of treatment in a timely manner. At its core, an innovation project is designed to better understand how to serve unique communities. No California county is the same, and each county has different characteristics that contribute to local mental health needs. Innovation funds allow for counties to try something new in order to develop a new best practice in mental health services and supports for their communities. While each county receives an allocation of innovations each year, the Mental Health Services Oversight and Accountability Commission provides approval for spending these dollars. Butte County currently has 2 approved innovation projects in operation, Physician Committed and the CARE Project. You can find more information about these complex projects and our MHSA plans, which are located on our website. At the inception of the MHSA, these 2 funding components were allocated one-time funding for all counties, with a 10-year timeline for spending. Butte County has used all funding in these components to address the enhancement of our workforce and the physical locations needed to provide new MHSA programming. Capital facilities and technology and workforce education and training are still a large part of the MHSA, although they do not receive annual funding. You may remember from a few slides back that up to 20% of funding can be diverted from the overall allocation, and we take advantage of this regulation to implement workforce education and training initiatives. These initiatives include dedicating funding to job-specific training, cultural trainings, and our peer specialist workforce. Community input. Every 3 years, an MHSA program and expenditure plan is developed in partnership with community members and stakeholders to analyze the mental health needs in our community and to identify and reevaluate priorities and strategies to meet those mental health needs. MHSA funds must be spent according to the plan, and there must be evidence that the community and stakeholders participated in the development of this plan. Each plan provides an overview of Butte County, MHSA initiatives, expenditure information, programs, objectives, and supporting data, and annual updates are required in between each 3-year plan. The MHSA began with the community voice. Californians not only urged for more mental health services in local communities, but they advocated for change in the way California treated mental illness. Embedded in its regulations is the requirements for meaningful stakeholder inclusion at all levels of program planning, development, oversight, and evaluation. In Butte County, we value the voice of our clients, peers, advocates, family members, staff, and community partners. We gather feedback on all aspects of the MHSA through community input meetings, focus groups, and a specially designed survey. MHSA is a standing agenda item on the Behavioral Health Advisory Board, and MHSA reports are given at various community meetings. Butte County facilitates an MHSA steering committee, which provides feedback and input on the community planning process, program evaluations, and innovative ideas. All plans and proposals are posted for a 30-day public comment period before being presented at a public hearing. Butte County has allocated resources towards thoughtfully building policies and procedures surrounding community and stakeholder engagement, and is always looking for ways to improve this process. In this slide, you will see a visual representation of the process. Broad community input is gathered and put into a report that is easy to read and understand. This report is utilized when designing the MHSA 3-year plan and its annual updates. The MHSA plans are reviewed in detail by the MHSA Steering Committee and Butte County Behavioral Health leadership. Plans must be approved by the local Behavioral Health Advisory Board prior to County Board of Supervisor approval. Thank you for your time and attention in this introduction to the MHSA. Please consider getting involved and providing input on your local MHSA initiatives. Consider sharing this presentation with individuals who would be interested in providing input on these services. If you would like to learn more about the local MHSA, you can visit the Behavioral Health website and look for the MHSA info icon. If you would like to learn more about statewide initiatives and oversight of the MHSA, you can visit the following websites. If you have any questions, suggestions, or comments, please email mhsa@buttecounty.net. Thank you.
Okay, thank you for sitting through that video. So as we mentioned in the video, community input is so important to the MHSA, and then brainstorming with the MHSA steering committee, they really advocated for the introduction to the MHSA. But I thought with this group today, you might be interested in learning a little bit more details about the programs that are available instead of the high level overview. So you heard me mention these in the video, and I think it's important to note that this funding stream really, one of its regulations was that it could not take over already funded programs. They had to be an expansion of programs or brand new programs. So what you're seeing here today is not the entirety of the behavioral health services that are provided, but these are specifically the ones that the county community stakeholders said that they would like this funding stream to be allocated towards. So our crisis residential facility is our Iris House. It is located right next to our crisis services and our Chico Adult Outpatients Clinic. And it's a 10-bed facility with an average of 30 days. It is a voluntary program, but it does provide 24/7 around the clock care. The Crisis Triage Connect team provides intensive case management for entry into a hospital or post-discharge, providing that connection to outpatient services following a psychiatric hospitalization. And then the mobile crisis team, you may have heard of it. It's in the news quite often, as it is a collaboration with the Chico Police Department to co-response to mental health or psychiatric crisis emergencies. The Wellness and Recovery Centers, the Iverson Centers, located near our Chico campus as well. There's an Orville Wellness and Drop-In Center. The Youth Empowerment Support Program, it is brand new. We're partnering with Wayfinder Lilliput Family Services this year to provide this adjunct service for our youth intensive program. And it's the opportunity for youth to gain leadership skills, confidence, and advocacy outside of their original setting. So, and then for outpatient programs, I mentioned the full service partnership programs in the video. We call the adult program SEARCH, which stands for Support, Engagement, Advocacy, Recovery, Community, and Housing, and the youth program, the Youth Intensive Program. So for youth to have access to the Youth Empowerment Support Program, they are already enrolled in Youth Intensive Program. We also have Complex Capable Teams, which is a multidisciplinary team in our outpatient setting, which is a step down from FSP level of care. For community, this is my second slide for community services and supports. The vocational and job skill building programs, you might be familiar with Avenida Apartments located off Esplanade. In the very back, there is a bike shop, and Sensible Cyclery is a part of that program. So this is permanent supportive housing, as well as a job skill building program embedded within Avenida Apartments. They also provide Pro Touch services, which is a cleaning service in Chico and Orville. We have contract with Department of Rehabilitation, and we also have our STEP program through Dreamcatchers. And these are all available to our consumers of our services and a way to get them back in the workforce, build their resume, and gain some confidence around their job skills. The supporting homelessness umbrella term that we talked about, this is a little bit more details about what this allocation goes towards. And every year we go out for community input, and every year we hear that we need to provide more supports to homelessness. And I want to just mention again, this is not the entirety of what the department provides towards supporting homelessness, but this is what is funded through the MHSA. And I'm happy to answer any questions that you might have, clarifying questions about any of these programs if you want more details about them. I already mentioned Avenida Apartments. We also have a continuum of care coordinator that's housed in the Department of Employment and Social Services in their homelessness branch. We support that, the position partially, as well as the city of Chico. We have a housing consultant that actively seeks out projects that behavioral health can partner in, or this person may even advocate for new affordable housing projects to have dedicated units for our clients, and we provide supportive services on site. The homeless peer partner program at the tourist shelter, those are individuals who have lived experience with either mental illness or homelessness, and they are working to build engagement and rapport with shelter guests and get them connected to the services that they need. We provide some funding for the point in time survey, the homeless census that's done every 2 years here in Butte County. And then the housing that I already mentioned for the transitional aged youth. We partner with Youth for Change. And it's actually the funnel into that housing is from our 6th Street Drop-In Center, the Youth Homeless Center, which also provides mental health treatment on site. So that is all of our community services and some supports programs. I can pause for questions now, or we can just get through the presentation. I know I want to be mindful of time.
If anybody wants to ask a question, just unmute yourself.
Great. Our prevention and early intervention is only 20% of our annual allocation. And that is the mental health awareness, the community campaigns, our partnership with our local Butte County NAMI. The prevention unit is our Gridley and Orville Life Spots, which are drop-in centers for youth. In those what are considered underserved populations. Our access and linkage to services is our welcoming triage and referral. The North Valley Talk Line, which is a partnership through North Valley Catholic Social Services, which is a line that is open. Well, prior to the pandemic, it was open after hours to provide additional support to clients from it's manned by all peers. But now with the COVID, it has expanded to have additional hours. Our cultural outreach programs are the African American Family and Cultural Center in Southside Orville. Passages Connections through partnership with Chico State is an older adult intervention program. There's Promotores programs in Spanish and in Hmong, which are bicultural leaders that go into the community. And because they're a member of an underserved community, they may have more success with overcoming barriers and reducing stigma to accessing treatment. The Stonewall Alliance in downtown Chico, the piece of that we fund is sensitivity trainings in the community to increase awareness of this population who may be more at risk for mental health, substance use, and as well as suicide. And then Janjia is our program at the Hmong Cultural Center, which provides support to elders that were immigrants due to the Vietnam War. Checking my chat. Okay, we're good. And then the video that you saw, which talked about innovation, it does need to be updated. We no longer have the CARE project as an innovation. We continue to support Physician Committed, which some of you may be familiar with. And it was originally approved for 3 years. And now we just additionally got 2 more years in May. So it was approved in May of 2018 and also May 2021 to continue for 2 more years. And the project that we're working on right now, it's pending approval. It's not quite done with its development, but what we heard loud and clear from the community time and time again, as I mentioned, is to provide additional support to those who are homeless and may also be suffering from a mental illness or a substance use disorder. And so we had to come up with a research question where we can really dive in and understand what are the barriers to those individuals receiving services. And our response is the Resiliency Empowerment Support Team. So this project will strive to provide a framework to overcome the individual's barriers to services, as well as us as a provider, our barriers to engaging them in treatment through an intensive outreach and engagement in the community. And once we've gone out into the community, and we'll also be accepting referrals from the community members and family members for individuals that they think would be eligible for this program, that once they're enrolled in the project, that a robust menu of services located at the Chico Behavioral Health Campus will be available to them. And that includes Everhart Village, which is a tiny home village that is being established in partnership with Chico Housing Action Team, as well as on-site medical care, a pharmacy, and a computer lab. So a lot of moving parts in that innovation, and we continue to meet weekly and get stakeholder input on that. And I'm happy to share more information on that project and what the next steps are if there's any interest in that. Workforce education and training. So I wanted to show you something a little bit different than you saw in the video. You saw what we fund locally for workforce education and training, but we also have this other piece where we have applied for grants through the Office of Statewide Health Planning and Development. And one is the psychiatric education capacity expansion, where we partnered with Healthy Rural California with the support of Butte-Glenn Medical Society to train psychiatric residents and fellows in a public mental health setting. So that has been a heavy lift, and Christy has been wonderful to work with on that. As we move forward, we just finally hired a medical director, which that position was vacant for quite some time. So we're going to see some, I think, progress on that project soon. The other project that we have been able to receive statewide WET funds is through a regional partnership grant. And Butte County serves as the lead for this grant for the Superior region, which is the 16 most northern counties. So that program is, the framework is almost completed so that we'll be able to provide loan repayment, educational stipends, and scholarship for career advancement, as well as specialized training in the workforce. And internship coordination. So that is really about retaining and bringing new staff and workforce into our setting. I think one thing I probably didn't mention is really to give you some framework of what the MHSA funds for our entire budget. When you factor in the MHSA allocation that brings down Medi-Cal revenue, we have about 25% of the department's overall budget. So I think that's always an interesting thing to throw out there so you can kind of understand that this 25% of our department would not be made possible without the passing of Proposition 63, since it had to be either an expansion or introduction of a brand new project into Butte County. So with that, I would like to conclude the programming that I have put together for everybody, and looks like Barbara says she's interested in next steps for the REST project. So the next steps for the REST project is we're completing our evaluation framework, and that's really how we would research our learning goals and see if all these things that we're throwing into this robust menu of services will address the barriers to treatment and really reach that hard to target population. That population we consider high utilizers of our crisis services and our inpatient facilities. They have been offered the opportunity to engage in services, but have refused, whether that's a lack of insight into their condition, stigma related to accessing services, even practical barriers such as transportation. That's why we have the tiny village that's going to be located next to the behavioral health campus. So once that is completed, we will submit to the OAC's innovative support staff to receive technical assistance on our idea and ensure we're meeting all the regulations, because we will have to go in front of a commission, and a commission that is appointed by the governor, and they will vote on our project, and they provide the approval authority for spending those dollars. So while we already have that allocation, we're hoping that the commission will see that this is very innovative for Butte County and something the stakeholders have been asking for and talking about really since 2019. Once we finalize our proposal with the help of technical assistance, we will post for 30-day public comment period. Then we will ask our Behavioral Health Advisory Board to recommend approval to the Board of Supervisors. And once we achieve the Board of Supervisors approval, then we can formally be placed on the calendar for the commission and do a presentation, and they will vote. It's a very nerve-wracking process. It's a very long process, but I feel very confident we have a lot of community support behind it. So we're excited. Any other questions I can answer? I don't know if no questions is a good sign or a bad sign. Thank you for letting me present today. I really appreciate the opportunity. We do have an email distribution list. If you go to buttecounty.net/behavioral health, there's one of the little orange buttons says join email. You can click on that every time we post anything for 30-day public comment period, or if there's an opportunity for community input, we share that there. So, and I can also put the link in the chat for if you would like to join that email distribution list, if that's helpful.
That'd be great.
Okay. Thank you.
Thank you, Holly. And thank you very much for mentioning the psychiatry residency program. We are working together. Behavioral Health Butte County is a very key partner to making this happen with Healthy Rural California to use some ACGME graduate medical education language. Healthy Rural California is going to be the sponsoring institution, and our first graduate medical education program that we are very, very focused on and hear from everyone in the community is most needed is psychiatry. We would be seeing the first cohort of psychiatry residents coming into Northern Butte County in the spring, summer of 2023, which is not that far away. It's a good 3 to 5 year process just to bring the residents in. And we're sort of like in that halfway mark. So very excited for 2023 and seeing the first cohort of what will eventually be 16 psychiatry residents coming through the area and rotating through the different clinical facilities that we partner with. Key among them, of course, is the county and their PUF. So we are very excited, and I'm more than happy to share details about that at another time. And as Holly just described with their one program, it's nerve-wracking because there's a lot of building this psychiatry residency program before the residents come. And so there's a lot of partnership that we need and support to make this happen and to get to accreditation by ACGME, which is the accrediting body for all graduate medical education. After the psychiatry residency, just one last note, we hope to do something in primary care, whether it's family medicine or internal medicine. That is up to another feasibility study that we hope to be conducting sometime in 2022, 2023. And perhaps those residencies can be integrated with behavioral health. So there's a lot of movement in primary care to sort of take on some of the needed behavioral health work that a family medicine or internal medicine doc might not necessarily have done in the past, but can, do going forward. So we'll be exploring those other residency programs, but they'll likely have that integrated behavioral health element in them. So thanks for mentioning that, Holly. I just had to speak up and share that. And thank you for sharing that mailing list. I'm actually going to join that. So next is Linda Emmerling from Enloe Behavioral Health. And Linda, I think you should be ready to share your slides. You just have to share screen, and I'm going to make sure you would need to unmute. There we go. All right. Thanks so much, everybody. Here's Linda.
Can you guys hear me? Yes. Hi, everybody. My name is Linda Emmerling, and I work with Enloe Behavioral Health. I do the community outreach for our program. I have been doing this, working with this program for about 3.5 years. I've been with Enloe Medical Center for 20 years, coming up in October. So I have some information about our program. So for Enloe Behavioral Health, we provide patient-centered psychiatric care for adults 18 and over. And we are a voluntary acute care program. Enloe Behavioral Health is the only voluntary acute care inpatient mental health program for adults north of Sacramento to the Oregon border. So we're the only ones that provide this service from Sacramento all the way up to the Oregon border. What our program offers is we do free assessments for the patients. We prefer appointments if they have some time to call us and let us know that they're going to be coming in, or we'll be more than happy to take walk-ins. The assessments are available to the patients 24 hours a day, 7 days a week, including holidays and weekends. To our program, there is no referral needed. So a patient could walk in needing help. There is no need to have a referral from a physician or a clinic or anywhere if they need to come in for any kind of service. Our program, we accept private insurance, and Medicare is what we accept for insurance for the program, which also includes Medicare and Medi-Cal. So they can have Medi-Cal as a secondary as well. We provide care for our patients 24 hours a day, and our program is strictly confidential. And how we can help the patients. What we do is we stabilize the crisis that led to hospitalization. We provide a thorough evaluation for the patient, and we develop a treatment plan individualized for each patient. And that includes a plan that coordinates cares in a supportive environment, as every patient is a little bit different on the care that they need. So it's individualized for the needs of each patient. I have a list of examples of admission criteria for our program. On this list is some of the examples of what we see patients for. And our list is not black or white. So if there's something else that's going on with the patient that may fit the criteria, please always give us a call. I've listed the phone number at the bottom. So this phone number here, you can call 24 hours, 7 days a week if anyone is experiencing any help or anything that they need help with in mental health. A nurse will always pick up the phone and guide them in the right direction. Right here is a slide of our team. We have Dr. Nichols, who is our medical director, and Dr. Amir are both our psychiatrists here on the unit. Our physicians here at Enloe Medical Center work with registered nurses, social workers, licensed psychiatric technicians, and mental health workers here on the unit for our program. And then we are located at 560 Cohasset Road. So we're facing, our door faces the Rio Lindo entrance. And our phone number is 332-5250. So if there's any help that's needed, please feel free to call. I've also listed our website, www.enloe.org/wellness. This has some information about our program and our program schedules, and what are the reasons that we see patients for here. Is there any questions at all?
Remember to unmute yourselves if you have a question. All right.
No?
I'm not seeing anybody unmuting themselves. That's they know how to reach you now. That's
Yes.
good. All right. Well, thank you so much, Linda. And
Yeah, of course.
we'll have to partner with the Enloe Medical Center for the CME that would be from this presentation. So glad you could share this with everyone.
Yeah, thank you for having us.
All right. Well, if anybody has any more questions for Holly or Linda or myself, let us know. Otherwise, have a wonderful rest of your day. We'll be doing another virtual grand rounds next week on diabetes updates on treatment with a physician from Ample Health. So that'll be next Thursday. All right. Thank you. Good to see everybody. All right. Well, thank you so much. Take care.